Welcome back. The director for the Centers for Disease Control and Prevention announced the top 5 areas he thinks should be public health priorities in 2014. Well, as a part of Healthier Tennessee's Start Now initiative, we're bringing you ways that you can live healthier each Thursday at noon. And so here to offer suggestions on how we can help the CDC to reach its goals and just give us some perspective on what these mean is Dr. Ed McBride from Summit Medical Group. Thank you so much for being here.
Thank you for having me.
Okay, so one of the top concerns that the Centers for Disease Control has is antibiotic resistance.
Yes.
So how real is this problem that we're dealing with here?
It's a very real and growing problem. You know, antibiotics have been around since 1928 when penicillin was first discovered. By the 1940s, we were revolutionizing the practice of medicine with antibiotics. Antibiotics, no doubt, save lives. However, inappropriate use of antibiotics and the length of time that they've been around has allowed the bacteria to change over time, many of which are becoming resistant to the antibiotics that we have available.
Yeah, and so that sounds very scary to us. So what can we do about it just as average folks who get sick and go to the doctor?
Sure. I think the first is to level set expectations. When you present to the physician's office, if your healthcare professional diagnoses you with a viral infection, antibiotics don't treat viruses. So it would not be appropriate for them to prescribe for you nor for you to take.
All right.
However, if they present, if they diagnose you with a bacterial infection, we need to make sure that we take the prescription as prescribed. You mentioned during the break that the last time you had a prescription you didn't finish it.
I didn't.
That's one of the keys. Making sure that we take the prescription until it's out, until it's over, in order to ensure that those bacteria aren't allowed the opportunity to develop resistance.
Yeah, I'm sure everyone's been there. I'm sorry, I didn't take mine.
We have. I have.
And it's one of those things, yeah, so that's really important. Okay, another major health crisis that we see here in Tennessee a lot, especially with law enforcement, is prescription abuse.
Sure.
So what perspective can you offer on that?
We are in Tennessee at the epicenter of an epidemic of prescription drug abuse. Tennessee was ranked second in the nation. Second in the nation for the number of prescriptions for controlled substances per capita. That's per individual in the state. It's pretty significant.
That's huge.
The number of deaths due to unintentional overdoses exceeds that of motor vehicle accidents in the state of Tennessee.
Wow.
When we're driving down the interstate, we now have these DOT signs that tell us what the count is to date, and it's a rolling 12 months, so it's always evolving and changing. But it's almost 1,000 folks die every year on the roads in Tennessee due to automobile accidents. More folks than that die from unintended prescription overdoses than actually die from motor vehicle accidents. So it's a very real problem.
Yeah, so what would you suggest that people should do about that?
You mentioned law enforcement. This is not a problem that can be solved by law enforcement alone. I think it requires a collaborative effort. And to that end, the Tennessee Department of Health, working with key stakeholders throughout our state, including healthcare professionals, including community representatives, has developed treatment guidelines around chronic pain management. From a patient's perspective, here's the key. Chronic pain is real. People live with it, and we want to effectively treat that while at the same time minimizing the risk for prescription drug abuse and addiction. The guidelines are out there to help clinicians understand what is the appropriate standard of care. They're not designed to dictate care, but rather here's the appropriate guideline for you to follow. And patients need to understand a realistic expectation in this area is that pain medicine will not cure whatever is causing the pain. Therefore, the goal of treatment isn't to take someone who has a pain level of 10 and make it 0 on a scale from 0 to 10, but rather mitigate and alleviate that while we're treating the underlying condition.
And not just always with painkillers. Well, we don't have time for our last one, but it's about the HPV vaccine, and I'm sure you recommend every woman get that.
Well, the bottom line there is cervical cancer is a vaccine-preventable illness. And there are vaccines available to treat HPV, which is human papillomavirus, which is a major contributing factor, causative factor for cervical cancer.
Yes, very important. Thank you so much. All right, we're going to send it out now to Mike on